And now it is my pleasure to welcome Dr. Jane Pritchard. Dr. Jane Pritchard has long been a supporter of the De Weber Institute and is a very busy family physician in Toronto. And she has a very special caseload with people who are refugees and those who are dealing with homelessness. And we are greatly honored to have Jane speak to us today about what she has learned from her practice of late during COVID-19. Thanks, Dr. Jane Pritchard.
Thank you, Martha, and hello, everyone. A little about myself and my journey as a family physician relevant to the stories and musings you are going to hear from me. In the stories, by the way, I have not used people's actual names to protect their identity. I have always found myself getting caught up in the lives of my patients and in the current events that shape them. I lived for a time in Australia. I worked in a Sydney emergency room, and I remember clearly telling myself after a frustrating string of encounters with addicted patients, I will never work with addicts. It was always one step forward, two steps back, it seemed to my youthful self. And often the step forward was lost in an inebriated haze, unrecalled. My husband and I and our 2-year-old son went to Bangladesh in the early 1980s to work, and I encountered crushing poverty and the injustices that perpetuate it. One pair of rubber thongs to a family worn by the breadwinner who toiled in the fields or pulled a rickshaw, the girls all anemic and dizzy from hookworm that entered via their bare feet. I came to Toronto in 1987, and here I stayed. I started working with Latin American refugees streaming in from the civil wars in Guatemala, El Salvador, and later Colombia. At the same time, I joined in the downtown practice of my colleague on site at a gritty drop-in center for homeless women who over time became housed and sometimes brought their male partners along. In 1991, crack cocaine hit Toronto in force, and our women spun out of control under its thrall. The older women were terrified by the young ones who were hyperkinetic and violent. Those young ones who survived are now old before their time, racked with physical and emotional pain from those times. After I'd been there 5 years, they started telling me their stories. And I had to re-examine my prejudices against the addicted. When they weren't spaced out or high, they recounted terrible tales of abuse from a tender age, in snatches that were hard to piece together. Under the hardened exterior, the wounded child lashing out at others and at herself. I came to understand that these women and men were severely traumatized at an early age, abused, neglected, used, till adolescence and freedom arrived with a measure of power. Many of these people have been my patients for 20 or 30 years, and I count it a privilege to know them. As for the refugees now well settled, I have often looked after their children and even grandchildren. Those from the street are generally cut off from their natural families. Some got housing, some live in shelters, some go from couch to couch, and some stay out all year. Onto this scene of unequal resources came COVID-19. Louisa is a hardworking woman in her 40s, a single mother. I have always gone out to work to help my family, she says with pride. I wasn't ever a person who went to parties. This spring, she came down with a cough, then fever and chest pain. It was COVID. She was pretty sick, febrile, short of breath, but stayed home and slowly got better. She told me she was really worried about her son, Jose. He was homeless and deeply into IV drugs. He's lost his way, she said to me. She feared he would get COVID, and she asked him to come home. I knew she was afraid of him because he had tried to beat her up before. I can't let him stay out there. He might die on his own or from COVID. It was scary for her having him around. He had a certain look in his eyes that chilled her. Around the same time, Marcy called me sobbing. Her 27-year-old intellectually disabled son, Tom, who was homeless, had appeared at her door and she couldn't turn him away. He had been living on the street and in shelters, heavily using crystal meth. He was violent and volatile. It took her a while to tell me that 2 nights before, she awoke to him trying to strangle her. "Just get him into a hospital so he can get treatment, she cried. She described that his paranoia had begun 4 years before, and he had started using fentanyl as a result. Although he had been in and out of jail many times, he had never, so far as she knew, had a psychiatric assessment. "If I turn him out, he'll go to a shelter and get into a fight and kill someone or get killed himself, or he'll get COVID and die. He doesn't know how to look after himself." She was making him soup and watching him devour whatever she set in front of him. Then he would fall asleep and twitch and scream at her. She refused to leave him. She was afraid he wouldn't wake up. I told her if he threatened her again, she needed to run out the front door, call 911, and charge him. We kept in touch by phone. Sometimes she couldn't say much because he was within earshot. He did try to strangle her again, and she did call 911 and charged him. And he spent a few weeks in jail. I don't know if he ever got a psych assessment. Fast forward 5 months, and Tom is back staying with his mom. I talked to her this morning. She said things were okay, but he was in the next room. Luisa called me and said Jose wanted help getting off drugs. He actually came to see me. This tall, serious young man told me he knew he couldn't do it on his own, and we made a plan that he would go to the local hospital's rapid access clinic the next week. I don't know if he went. The next week, when Luisa returned home from a medical appointment, she found him in his bedroom, lying dead on the floor. Where was help when these desperate mothers needed it? They were willing to risk their lives in order to protect their sons. Esperanza spent her last 16 months at home with metastatic cancer, tended to by her husband Carlos, her children and grandchildren, and her palliative team, much of this time during COVID. Afterwards, I was worried about Carlos. He never complains, and his daughter told me he was very withdrawn, not eating or sleeping. She called me after he had been coughing and febrile for a week. He did not want to go to hospital. He was short of breath on the phone. In the end, he took my advice and went to the ER. He was diagnosed with COVID pneumonia and started on antibiotics and oxygen, and was told he needed admission. He refused. He was adamant. He knew there could be no visitors if he was admitted. He told me, "I don't want to die alone," and he went home with home oxygen to his worried and grieving daughter. We stayed in touch by phone, and after a few days of getting worse, he turned a corner and started to feel well enough to eat and walk around. 2 weeks later, he's still on oxygen and slowly getting better. Let me tell you about Ethel, a lovely woman who is frail at the best of times. I suspect childhood malnutrition as she was orphaned early in life. Since being hit by a car over a year ago, she has struggled with headaches, dizziness and nausea, insomnia, and constant ringing in her ears. Then she developed an acute illness and required hospital admission, and finally, during COVID when it reopened, admission to rehab. This was going to be her chance to regain her strength while she was looked after. But she has very specific dietary requirements, and these could not be met in the hospital. A friend prepared for her a dish she knew she would eat, made from quinoa, and was turned back at the door. Neither she nor the meal could be allowed in. So Ethel lost weight from about 40 kilograms to 37 kilograms while in hospital, and was often too weak and dizzy to participate in therapy. She is now home, and her friends are preparing her food, and she is eating again and starting to feel better. And she is going for outpatient physiotherapy, despite the COVID risk of travel. I'm a firm believer in the science that drives our public health response to a dangerous novel coronavirus threatening the entire world. I wake up and check the COVID rates in Toronto and Ontario and Bangladesh and other places I'm interested in. Socially, my husband and I have been self-isolating since March, apart from a 4-day bubble with one son and his family in August. I tell my patients, when in doubt about your COVID status, self-isolate. This virus strikes us one at a time as single organisms. Some of us have been living in another sort of bubble for a couple of generations, believing that our state of being, our personhood, is the essence of who we are. But nothing has popped this illusion more than seeing how we can infect each other with this virus. Like it or not, we are part of a larger community. There are those nearest and dearest to us, and those we don't care about or even know in this community. The well-being of one affects the well-being of all. How do we weigh the value of the community in relation to the value of the individual in this pandemic? And which community do we count? Our neighborhood? Our city? Many of my patients from Peru and Ecuador and Nicaragua were already sending money home to families in dire need before the pandemic hit. Carlos thought life not worth living if the hope of survival meant separation from his family. In hospital, he would have been looked after by caring professionals, but they had no history together. He knew whereof he spoke, being beside his wife for the previous 16 grueling months in the company of their children and grandchildren. I struggle with this dichotomy, the weighing of the community against the individual. It is not something you can put into an algorithm. My son has lost his way, was how Louisa put it. Her words brought to my mind the parable of the lost sheep told by Jesus in the Christian tradition. What do you think? If a man owns 100 sheep and one of them wanders away, will he not leave the 99 on the hills and go to look for the one that wandered off? I think this is the paradigm for our age. So many people have gotten lost during COVID. Surely there is a way to safeguard the flock and preserve the one. Save the herd, if you will, and bring back the one who got lost. Find a way for the frail elderly to have their family members help bath and feed them. An elderly woman who speaks no English and is cognitively impaired was admitted with kidney failure to the ICU. For 3 weeks, she had no meaningful contact with anyone she could understand. Her son was relieved to bring her home, reassured by staff that she was better and that her skin was intact. There was in fact a stage 3 wound on her sacrum, and it took 3 months to heal. Had he and his sister been at her side, they would have fed, cleaned, and turned her day and night. We must find a way for the 87-year-old woman admitted with COVID on one floor to say goodbye to her husband, who died of COVID on another floor. Yes, the isolation prevents spread of the virus and saves lives today, but will that wife spend her remaining time on Earth grieving for not being with her partner? And will the family members, also shut out, become depressed, develop stress-related illnesses from not doing what they believed was their filial duty? There are the wounds we see, but there are also moral wounds when we cannot do the good we must, or are forced to do what we believe is wrong. And we must find a way for Ethel to have quinoa cooked just the way she needs it while in hospital so she can recover. But I'll tell you who are the most lost in our society in this pandemic: those who are addicted to drugs. Not ready to quit, pre-contemplative we call it, their supply cut off by the lockdown, too afraid of COVID to use with a buddy. In the pangs of withdrawal, they ingest or inject drugs that are contaminated, all alone. I'm part of an interprofessional team providing medical care in 2 Toronto community housing buildings in Scarborough, populated by those who have recently been on the street or in shelters. In the first 2 months of the lockdown, we lost 8 women and men to suspected opioid overdoses. Nobody died of COVID. Addiction is a complicated human problem which has become an emergency. It is beyond prevention, though prevention must happen. Right now, rescue needs to happen. Those 8 are a statistic to me, to you, if we do not have a relationship with them. But they are like Luis's Jose, like Marcy's Tom, a son, brother, grandson whose life hangs in the balance. In my experience working with addictions severe enough for them to lose jobs and housing, pretty well all of them have experienced severe trauma, either as a child or as an adult. This is what can happen to the ones who are torn from their families, as in the residential school system in Canada or the 60s scoop, or suffer beatings or sexual abuse within their families, or witness the horrors of war as a civilian or a soldier. And the harmful effects go on for generations. But now opioid addicts are dying alone in apartments and stairwells. In BC, from March to August, there were more than 100 deaths per month from illicit drug toxicity. By October, 1,200 people had died of fatal overdoses since January. What protects the herd endangers the one who is lost. Our harm reduction workers had to get out a subversive message to the users in our buildings. Don't use alone. That's more dangerous than getting COVID. In this pandemic, in every country of the world, we have to go after the ones who get lost. We have to look around and figure out who they are and how to bring them back to safety. From infants to the aged, those isolated with abusive partners, those too terrified to leave their homes, those without homes too terrified to use shelters, those desperate enough to use toxic drugs alone. The list goes on. As you can see, I have questions, not answers. I can see what needs to change, but I'm not sure how. I'm hoping our collective experience, built on that of our patients, can show us the way through this pandemic to a more equitable and compassionate future. Thank you.
Dr. Jane, thank you very much. You've spoken from a place of understanding patients' pain with care and kindness, to inviting us all to see that looking after the one and looking after community have to happen simultaneously. And your care as a physician means the people who are being seen by you are being seen in the way that we hope all medicine is being practiced. Thank you for inspiring us today and also calling us to use this time of this invisible microscopic virus as a way to look at our world differently and look at what each of us can do alone, but more importantly, collectively. Wherever we are, we can be part of finding this moment of time to be drawn to something better. So thank you very, very much for speaking today, Jane.